has been a bit of a relief over the past few weeks. In fact, cases seem to have plateaued for 37 odd days, Abantika.
Yeah.
And yet
38 now.
38 now. And yet this may not be all good news. Now, I'm not going to take up any further of your time. I'll leave it straight to Abantika, who tracks COVID for us, as you know, to answer this question in this episode of Government Matters. Please start sending in your questions as well. Why is it not good news? You've also done a story saying that.
Right. It's not good news because, see, it's true that the second wave peak was 414,000 plus cases. That was on 6th of May, and we have come down dramatically from there. But it is also true that if you look at the first wave peak of about 97,000 plus, which was something like 16-17 September 2020, from there we have just about a little less than half. And it's not a small number,
right.
You know. So this morning it was 43,000 odd cases. These are not small numbers. So, you know, it's true that half of these cases are coming from Kerala these days. But here's the problem. This is an open society right now. There are very little restrictions. You know, domestic travel restrictions are very little. There are state borders. So. And for a disease like COVID, for it to travel across the border to any state, it's just a matter of time if
right.
cases keep going on like this. Also, one very important thing is that when you are looking at 43,000 cases per day, and even if your deaths have come down, here's the problem. Something like 10% to 30% of COVID patients go on to have what is known as long COVID. And
right.
long COVID is, you know, there are every day we have new things being added to long COVID. You know, it seems like there is no part of the body that this disease leaves untouched and over a long period of time. So what is the long-term disease burden apart from now, you know, the risk of any the infection traveling from one state to another and going up anywhere, a super spreader event is all it's going to take. But apart from that, health system wise, are we prepared to deal with the long COVID also? Because remember, the first wave low point was in February this year, and we had come down to 9,000 cases. Now, so this certainly is not our low point. We have
seen nowhere close to the low point of the first wave.
Right. It's pretty high. Any other country apart from India, I mean, here, when you talk about numbers, especially disease, because of our population, you know, numbers don't look that big, but this in itself is a big number.
Right, right. All right. Okay, so, you know, because there are already so many questions coming in, I'll begin with them. This is from CR7. It's a handle called CR7. There has been a lot of buzz of mishandling of COVID in UP. Can you put some light on the handling of superb handling of COVID in Kerala and Maharashtra? So is that true anymore? Because you just look at the backlog that we are seeing in Maharashtra.
Right. So I don't know if that's like a serious question or a sarcastic question. I'm not sure. Yeah. So see, Kerala again. You know, I was just talking to some people this morning about Kerala. It's true that the Kerala model, if it is a model per se, it's still better than the national numbers, because their case fatality ratio, which is how many people out of 100 cases die, that is still fairly low. It is less than half of the national average. National average is 1.32. Their CFR is 0.5. So it's still pretty good. And also Kerala, another very important factor in Kerala is that recently, just yesterday, ICMR came out with the state-wide serosurvey numbers. Kerala had the lowest seropositivity. So that means a lot of Kerala is vulnerable, but that's not what makes it, I wouldn't say the word model anymore, but that's not what makes it different. Because see, it also means, I was just doing that calculation, when the serosurvey results came out, we had done this story that India sometime in June was missing something like 29 infections for every case that it caught.
Right.
For Kerala, that number is 5:1. So for every one case that they have, there are just four infections, which is a fairly good thing. But again, the same problem with Kerala, long COVID. I mean, yes, their health system is very good, but are they prepared? They already have such a high NCD burden. Are they prepared to deal with that? I don't know. That's a question that they will have to figure out, because they seem to be walking the UK way of letting the virus wash through the population.
Right.
That has consequences, long-term consequences. Maharashtra, on the other hand, has, we spoke about it last time, they've been adding deaths, every day they're adding deaths, such huge numbers. Sometimes I was looking at the data in the minute somebody was showing me the data. There are days when the backlog is 4 times the actual days numbers. So the death numbers in Maharashtra are really, really high, and they are high post facto. After we had celebrated them and after we had said that oxygen war room is such a beautiful thing. Now we are seeing all these deaths, and the problem with that again is when you report deaths so long after they have happened, how do you analyze, how do you prevent? A very important thing that you do in death audits is you understand that I did this wrong. So the next time when the similar patient comes, you don't do the same mistakes. But you can't do that analysis if you're reporting 2,000 deaths 2 months on. It's very unlikely that you'll do that analysis to any meaningful extent.
Right.
So I think Kerala is managing the pandemic differently from India. Whether it's better or worse, I can't say. But Maharashtra's numbers are, they're beginning to get very worrying.
Dubious now. And
I don't know. Some people still say that Maharashtra is honestly testing and honestly giving numbers. But this death number is something that is taking away from whatever they might have been doing.
Right. Okay, there's another question on Kerala, clearly that is on everybody's minds right now. Nikhil Deo, was it propaganda on part of the Kerala government to showcase effective handling of the pandemic to win elections, considering how cases are rising since September 2020? So was it also a bit of perception management? And you've traveled to Kerala yourself.
I can't say it was perception management, because the numbers are there. The contention that they are making is not that we are keeping cases down. They are simply saying that we are detecting cases early, we are putting them in home isolation. I was looking at their hospitalization numbers, they're still quite low. We are putting them in home isolation. We are detecting cases in remote areas, and that they can do because they have that kind of reach of the health system. During the second wave, states that saw all these bodies floating and all that, these are also states which have been notorious for the lack of their health system preparedness. And health system preparedness is something that we are now talking about it in terms of pandemic, but these states have had problems with health indicators like infant mortality, maternal mortality for years and years now. They've been dragging India numbers down, and these are the same states that actually had that those incidents of bodies floating in the river. So yeah, I can't say. I'm sure. See, all governments are doing perception management. All governments, so if you listen to the parliament discussions on COVID, you'd be appalled, because everybody says we did so well. All the regional parties who are talking, especially in Rajya Sabha, everybody says we did so well, we are a model, and then you're left wondering, so who did not? How did the India numbers rise?
Right.
So perception management everybody is doing, but Kerala, at least so far, has some numbers to back that.
Right.
Even with this current surge, it's CFR, and see, we are not accepting it, but when a disease becomes endemic, it's, let's say, the flu. When you get the flu, now, okay, I'll just complete this point and come to this. When you get the flu, the point is that you don't die, but you keep getting it.
Right.
Twice a year maybe you get the flu, but you don't die, and that is the point. That is where it should ideally come down to. I'm not saying Kerala has brought it down to the flu levels. I'm saying that that's one model, but it has its cons, as I mentioned earlier. Also, one very important point, since we are talking about Kerala's vaccination numbers are better than national average. Kerala has about 10% fully vaccinated people against national average of 7%, about I think 34% single dose against national average of 25%. But here's the thing, even when you have the vaccine, if you test enough, and Kerala is testing enough, if you test enough, would catch infections. The point is these will be mild diseases. They will
Right.
still test positive in RT-PCR or RAT for that matter. But these are mild infections, mild diseases that can be probably controlled at home without too much complications.
Right.
Actually, when we are vaccinating and given the mutations and all of that, obviously there may be vaccine escape, I'm not getting into that, but when we are vaccinating, what we are trying to do is to bring infections down to that level, mild infections, because
Right.
no vaccine is saying you will not catch
No,
the
nothing is
infection.
100%, right.
You will still get it, but the efficacy is how much is the vaccine preventing serious disease, hospitalization.
Right. Okay, this is from Shikhar Tawar, who is a member of our YouTube community. Why is the rate of vaccination not rising? Will the government meet the 186 crore target of vaccines till December? For that number, the government will also take into account vaccine under development. So has it also perhaps taken into account those vaccines which have not been launched yet?
Certainly they did. In fact, that number is already down to 135 crore. But to answer that question, numbers are not picking up because there are no vaccines. July, we had about 12 crore vaccines. August, what we were told yesterday is, this is the word the government used, not mine, that the visibility for August is 15 crore. And going by past experience, it is possible that it will not reach that stage because visibility is a very dicey word.
Right.
So even if it's 15 crore, we are not looking at more than 50 lakh vaccinations per day, and that I'm not even taking into account wastage. If we manage to use every single vaccine dose available to us in August, even then we are looking at like 50 lakh doses. So that is one thing. And another thing that is very certain is unless new manufacturers come in with some significant amount of manufacturing capacity, on Covishield and Covaxin, there is no way we
can meet these numbers.
The year-end target. That's not possible because there are efforts to manufacture Covaxin elsewhere. But it's you need BSL-3 labs. It's a complicated process. The process has been set in motion, but they will take time. You need to have those facilities. Those facilities take time to build. They have to, conform to certain standards. All of those things will take time. We have very high hopes right now on Zydus because the clinical trial results had come in and they've been submitted. They are being looked at. I think the government had asked for some data. They were supposed to give it on the 23rd of July. That is there. Then the Zydus and also, see, we are not even talking about children yet.
Right.
That is another conversation altogether. Then again, Moderna has been stuck for so long. It's apparently the government tells us that we are still waiting for them to revert, but my understanding is that it's that indemnity thing that it's stuck on, because if you give indemnity to one company, you will have to
give it to everybody.
In principle, give it to everybody. Right. So unless we have fresh manufacturers, these numbers look very difficult.
Okay, this is from Nikhil Deo. Why is less emphasis placed on the rise of cases in the Northeast? So, there's a lot of conversation around Kerala and Maharashtra, but not as much around the Northeast. We've done a detailed story on numbers in the Northeast, but yeah, is there less conversation around that, Abantika?
Yes, maybe not to the extent of that we have talked about Kerala and Maharashtra, but I have some numbers here. So 22 districts in the country have been reporting an increasing trend in daily new cases. This is as on 25th of July, and of these, 7 of these 22 are in Kerala, 2 are in Maharashtra. So that is 9. All the rest are in the Northeast, and the most number of cases are from Manipur.
So it's a cause of concern.
Most number of districts, not cases. Most number of districts where the numbers are rising. That is certainly a cause of concern because most of Northeast is also in lockdown.
Right.
So if cases are increasing so much there, and there are other issues there, like we discussed earlier also. Remote areas, tertiary care centers are far off. There are only so many of them. Reaching these places are tough for the patient to reach a decent healthcare facility on time, to get help on time. Those things are there are issues there. So yes, Northeast is a very big concern right now.
Right, and which is something I'm sure the government is also not,
Absolutely.
because the PM did meet CMs of the Northeast
Right.
state, did interact with them. All right, so Pramod M, who's a member of our YouTube community, in fact, any of you can become members of our YouTube community. You just have to pay 159 rupees a month. We have special perks for you, like early access to some of our most important videos, as well as member-only exclusive content. Okay, so Pramod wants to know, is the Sero survey true that 90 crore people have antibodies? Doesn't this look overstated?
So, see, if you want to question that data, there are many reasons why you can. For example, it just covers 70 districts, which is 10% of the country. You know, and these districts were basically picked at random last April 2020. And just because we started off there, we've been continuing with that. So you can raise questions, but the fact is, this is the only data we have.
Right.
This is the only nationwide data we have. And so if you look at the Sero survey numbers, I don't know about, I can't say so much about the other places, but because we're talking about Kerala, the 44% seropositivity in Kerala and the way the cases are rising now, that actually sort of tallies. And
Right.
because low seropositivity means that more people are vulnerable. And also, see, just to give an idea about the range, the highest is in Madhya Pradesh, that's 79%. And remember, at one point of time, we were actually looking at that kind of a number for herd immunity.
Right.
Now we don't know. And because of variants, we don't even know if herd immunity works. But I am not qualified to actually
Question the data.
question the data or sort of
Diss it.
talk about the quality of that data, but that's data that's available, it's government data, and it's the best we have right now.
Right. Okay, so I'll take this last question from another YouTube member of the print community, Sanjay Akela. Is India making sure everyone is prepared in case of another wave in terms of availability of oxygen, more health facilities, etc.?
We are told that we are prepared. Also, there is this thing about, you know, children are your completely unvaccinated population, and the government has already reached out to states and told them that, you know, we need to have pediatric healthcare infrastructure in place, because doctors are one thing, then ventilators, I think the tube that you use, children need a different tube, if I'm not mistaken.
Okay.
So those preparations have to be done. But the real question really is, do we have that many doctors if we are looking at a pediatric outbreak? Really, I don't know if we are. Oxygen, we are told that all these PSA plants that were being set up, so we are told they are on course. We have also the Supreme Court, that committee that the Supreme Court had put together. They have given some very clear formula that you have this many beds, normal beds, then per bed you need this much oxygen, per ICU bed you need this much oxygen. So I think we've done a bit of background work, but it's only when it hits us that we really know how well prepared we were. We also thought we were well prepared before the second wave.
But clearly we weren't.
Yeah.
All right, but I'm going to go with what Abantika said in her last Government Matters, that we may not even have a third wave. So that's the optimistic. Do you remember you ended on that optimistic note the last time? So I'm going to, that's what I am constantly thinking. Doesn't mean that you don't have to take precautions and not follow COVID protocol, but just let's hope for the best, prepare for the worst, as they say. There are lots of questions which, because of lack of time, unfortunately we couldn't take. Soyanto Das, Lakshman Singh Rathore, SV, Krishna Mahatre, V Praveen, Ailesh Dupte, Orithro Pathak, Tanveer Panjwani, Prateek Singh. So really a lot of viewers have sent in their questions. Perhaps I can request Abantika to reply to some of them on YouTube, as a comment. Thank you so much for watching Government Matters and for sending in your questions. Keep subscribing to our YouTube channel. In fact, become a member of our YouTube community.